Hello, Dr. James Bogash, expert in health and longevity and the author of a book on migraines and epilepsy, which means this, and a dog lover, which means this particular study just really rings lots of positive bells. And it has everything to do with severely medically refractory epilepsy, meaning people with seizures, they're being loaded up with medication and they're still having seizures. Interestingly enough, when we look at, now that's a whole nother, medically, they're being medically treated. That doesn't generally mean things like exercise and stress management and targeted mitochondrial support. It means medication or VNS stimulators or maybe even surgery. So always understand that medically refractory does not mean you've done everything. It just means that there's no longer any prescriptions that are really helping. About 30% of people fall into this category. Not in this video to go over everything that I've covered over the years that have been shown to help with even these tough seizures from a natural standpoint. So we've seen animal, like pet ownership, helping with things like longevity and cardiovascular disease. In seizures, we've seen seizures be able to detect oncoming seizures hours before they happen. It's just staggering just from smelling the sweat of somebody who's epileptic. Just crazy. Certainly videos of seizure dogs protecting their owners so they don't bang their head. Pet owners are less likely to experience SUDEP, so sudden unexplained death in epilepsy. Lots of good things come with our relationship with our canine companions, possibly feline as well, but there's no epilepsy-trained cats that I'm aware of, or rats or hamsters or whatever, so they're usually seizure dogs. So in this particular study, following out of the Netherlands, following 20 people with medically refractory epilepsy for about 3 years, 20 of them, I think it's 20, there were 30 in the study, 20 of them ended up getting dogs during the course of the study. And they found that 7 of the people in this group, so not quite, about a third, little more than a third, had a 50% reduction in seizures. Like it's a pretty significant drop. On average, having a dog, a seizure or an epilepsy trained dog, in this case, led to 3.1% lower seizure frequency per month. So that starts to add up. And it could be something as simple as the stress reduction, because stress is really bad for the brain. Seizures, epilepsy, not excluded. So it could be something that simple, not really sure. But this relationship we have with the animals in our life has a definite benefit across multiple scenarios, so it's not a surprise to see them lowering seizure frequency, also increase quality of life in these medically refractory patients with epilepsy. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.